What is urinary incontinence? I'm the Kegel Queen. I'm a registered nurse and my name is Alice Adams. In this video, we'll talk about what incontinence is and two types of urinary incontinence. Basically, I think you probably know this, urinary incontinence is when pee comes out when you don't want it to. Sometimes it's a tiny little leak, sometimes it's a big flood, but that's basically the idea. Urine comes out at a time when you did not mean for that to happen. That's incontinence. And we'll talk about two main types. Now, among medical people, there's a little more like there's functional incontinence where somebody maybe can't get out of their clothes in time. We're going to talk about these two physical kinds of incontinence that really have to do with what's going on in the bladder and the surrounding muscles. So two types, we have stress incontinence and urge incontinence. Stress incontinence is related to your activity. So if you sneeze or laugh or cough, run, jump, lift, yell. I had a friend who suffered from incontinence and she said she was at her kid's baseball game and yelled and all of a sudden she's completely soaked. So any kind of activity that increases pressure, the way if you think about coughing or laughing, increases pressure in your belly, and that puts pressure against your bladder and can cause you to lose control of your urine. Of course, not everyone has this, but if you are suffering with stress incontinence, it means that these muscles here, your pelvic floor muscles, are not doing their job. This is the pelvis, this bowl of muscle in the bottom here is your pelvic floor. This bowl of muscle, and part of the pelvic floor's job is to control, along with your bladder, it works with your bladder, but the pelvic floor has a number of jobs in the body, but one of the really important ones is helping you eliminate pee or poo when you need and want to, and helping you not pee and poo when it's not the right time. So if you're losing control, that means the pelvic floor isn't doing its job, and we'll talk in a minute about how to help the pelvic floor do its job better. That's stress incontinence. Then we have urge incontinence, which means that you lose control of your urine following a sudden uncontrollable urge to pee. Now, if you have heard about overactive bladder, which interestingly is a term that was developed by the pharmaceutical industry, that term overactive bladder is a fairly new one, but if you have urges like that, sudden uncontrollable urges, sometimes you might be able to hold them back, and some people can hold back those urges. But if you have the urge plus you can't control it and the pee actually comes out, then you have urge incontinence. And this can happen anytime, any place, but it is especially common when you are coming home from somewhere or at another time when you're used to going to the bathroom, like as you approach the toilet. Or there's a thing they call key in the lock syndrome. When you're coming home, your bladder, with its little mind, your bladder says, "Oh, we're home now, it's time to pee." Bam! Urge incontinence. So if that's the case, there are things you can do, and we'll talk a little bit about that in this video as well. Then there's mixed incontinence, a combination of both. And one of the things you can do is Kegel exercises, and doing Kegel exercises correctly is essential, and it's something that almost no one is doing, even if you learn from a childbirth educator or a physical therapist or a doctor. So correct Kegel technique is tremendously important, and it's tremendously effective. For example, one study looked at stress incontinence and urge incontinence and Kegels, and compared women doing Kegels correctly with good technique to women not doing Kegels. The women with urge incontinence who were doing Kegels were 2.5 times more likely to see improvement or total cure than the ones not doing Kegels, which is pretty darn impressive. With stress incontinence, though, the women doing Kegels were 17 times more likely to see improvement or cure than women not doing Kegels. And that all worked because they were doing Kegels with really good technique, which is something really, really important. If you'd like to find out more about Kegels and incontinence, please come to kegelqueen.com. I'm the Kegel Queen, and I'm here to help.